Hi friends, welcome back to the channel of Agatandra, that is toxicology. Today let's discuss the topic Dooshivisha, which we can call in modern terms as cumulative toxicity. Coming into the nirukti of the Dooshivisha is Doshidam Desha Kala Anna Divasopned Abhikshnashaha Yasmat Dushayade Dadum Tasmat Doshivisham Smridam. The meaning of this nirukti is that the poison which vitiates the dhadus because of aggravating factors such as desha, kala, anna and diva swapa. It is called as doshivisha. Here the Tika says that for the desha it refers to Anupa Desha Pradesha, and for kala it refers to cloudy or windy day or rainy season, and the diet refers to Sura, Tela, Kolatta, etc. and Devaswapa refers to the daytime sleep. All these factors, when they consume repeatedly, it results to the aggravation of the dosha in the body, and it results to the formation of doshi visha. And there is also one reference that Prag Vada Ajirna Shedabra Divasopna Ahidashinihi Dushtam Dushede Dadun Adu Dushivisham Smridam. The meaning goes as Pragvada, that is the Vada which is coming from the eastern region, Ajirna because of the indigestion, and the seasons they mentioned it as in the Shida Ritu, Abra Ritu, that is the cloudy seasons, then because of the Diva Swapa, that is due to the daytime sleep, and Ahidashana due to intake of Ahida Ashana, Ahida Anna, etc. It results to the dosha of the dushti of the dhatu, and it results in the formation of doshi visha. It is called as or referred to as the doshi visha. Next, another reference in Sushruta Samhita is that yet stavaram jangama kritrimam va dehat ashesham yat anirgadam tad jeernam vishagna aushadibir hadam va davagni vadadaba shoshidam va sobhavado va guna viprahinam visham hi doshi vishadamubedi dirgha alpabhavan nibateyetat kafavradam varsha gananubandhi. The meaning is that a poison which is either stavara, jangama or kritrima, whenever not fully eliminated from the body and attenuated by anti-poisonous remedies, or gets dried up by the davagni, that is the fire, vada, which is the wind, atapa, the sun, or when the poison becomes less potent, it is referred to as doshivisha. And because of its mild potency, it does not prove fatal for an individual, and as it gets enveloped by the kapha, it resides in the body for many years. That is, if we are affected by any of the vishas which is mentioned as Tavara, Jangama or Kritima Visha, it is not getting fully eliminated from the body. We have already done the therapies or we have done the treatment, but when the small portion of it remains in the body, or sometimes it do not show the symptoms at that time, but because of all these factors which I mentioned earlier, they get aggravated in our body, or we have already given anti-poisonous remedies and all, or by the dried up by this davagni, vada, atapa, etc. The poison becomes less potent. They are referred to as the doshivisha. Then the Purvarupa of the Doshvisha is mentioned as Nidra, Gurutvam, Cha Vijrumbanam Cha Vishlesha, Harsha Adava, Angamardaha. That means the Purvarupa includes Nidra, sleepiness, Gurutva, which is heaviness of the body, Vijrumbana, that is yawning, Vishlesha, that is feeling of the loosening of the joint, Harsha, that is horripilations in the body, and Angamarda, that is body ache in the body. These are all the Purvarupa of the Doshivisha. It should be noted that in the Agatandra, for only Doshivisha, Purvarupa is mentioned. Okay, and in this mentioned that Nidra, Gurutvam cha Vijrumbanam cha Vishlesha Harsha Adava Angamardaha. Then the Lakshana goes as Tena Ardito Binna Purushavarno Viganda Vairasya Mukha Pipasi Murchan Vaman Gadgada Vakvishanno Bhavecha Dushyodara Linga Jushta. That is, the person afflicted by this will be having the symptoms like Binna Purusha, that is loose motions, the diarrhea we can mention, Vaivarnya, that is discoloration of the skin, Vairasya Mukha, that is anorexia, Pipasa, which means intense thirst, Murcha means the person may faint, Vamana, that is they may have vomiting, Gadgada Vani, that is they may having a stammering speech, and Dushyodara, which is having the Tushta Udara Lakshana, which includes ascites, etc. Then the symptoms according to the situation of the Dooshivisha is mentioned. That is, Amashyaste Kafavada Rogi, Pakvashyaste Anila Pitta Rogi, Bhaved Naro Dwasta Shiroruhango Viluna Pakshastu Yada Vihangaha. That is, when it is located in the Amashaya, it produces diseases of Kapha and Vata. And when it is located in the Pakvashya, it produces the diseases of Vata Pitta. That is, Amashyaste Kapha Vata Rogi and Pakvashyaste Anila Pitta Rogi. Then an important reference or simile it is mentioned in the Dooshivisha, that those persons is afflicted by the Dooshivisha, that is Bhaver Naro Dwasta Shiroruhango Viluna Pakshastu Yada Vihangaha. Sometimes the question may ask, that is, this reference is given in which context? The meaning goes as, those who are afflicted with the Dooshivisha, they will be having loss of hair and loss of strength, and they will appear like the bird which has lost its wings. And this shows the Dhatu Tushti Lakshana of the afflicted Dhatu. Next, another is Sthidam Rasadishu Adava Yadoktan Karodi Dhatu Prabhavan Vikaran Kobamcha Shidanila Durdineshu Yatya Ashu. That is, wherever it is poison, that is, this Dooshivisha is situated, wherever in whichever Dhatu this Dooshivisha is situated, it produces that Dushti of that Dhatu, and it gets aggravated due to the factors which I have already discussed, that is Shida, Anila, Durdina, etc. It gets easily affected during these reasons. Next, the Karya. The another Lakshanas which are mentioned are Tadaha Karodi, Annamada, Avibhaga, Arojaga, Mandala, Kota, Mohan, Dhadu Kshayam, Pada, Kara, Asya Shofam, the Godaram, Chardim, Ada, Adisaram, Vaivarnya, Murcha, Vishama Jwaranva, Kuryat, Prabhrittam, Prabalam, Trishamva, Unmadam, Anyam Janayet, Tada, Anyad, Anaha Manyat, Kshabayecha Shukram, Gadgadyam, Anyan Janecha Kushtam, Tamstan, Vikaranscha, Bahu Prakaran. If we look in the symptoms, it goes as Annamada, which means intoxication after the food, Avipaga, indigestion, Mandala, eruption of circular patches on the skin, Kota, that is urticaria type of manifestation, Moha, that is mental confusion, Dhadukshaya, that is decrease of the Dhatu dosha, then Pada, Kara, Asya Shofa, which means edema of the face and the extremities, the Kodara, that is Udara Roga, Chardi, vomiting, Adisara, diarrhea, Vaivarnya, discoloration, Murcha, fainting, Vishama Jwara, that is intermittent high fever, Prabala Trishna, that is excessive thirst, Unmada, insanity, that's mental disorders, Anaha, constipation, blotting of the abdomen or maybe due to the constipation, Shukrakshaya, that is reproductive dysfunction, Gadgada Vakya, that is speech defect, Kushta, skin diseases. All in this, the Lakshana of all Dhatu Dushtis, it is mentioned in this sloka. Next, the Upadrava is given in Dooshivisha. They are Jwere, Dahecha Hikkayam, Anaho, Shukra Sangshaye, Shofo, Adisare, Murchayam, Hrudroge, Jadare Abicha, Unmade, Vebado, Cheva, Ye, Cha Anye, Surubadravaha, Yadaswam, Teshu Kurveda, Vishagne, Raushadehi, Kriyam. The Ubadravas are Jwara, which is fever, Daha, burning sensation, Hikka, hiccup, Anaha, blotting of the stomach, Shukrakshaya, that is loss of semen, Shofa, swelling, Adisara, diarrhea, Murcha, fainting, Hridroga, heart disease, Jatara, that is ascites, Udarroga, Unmada, insanity, mental disorders, Vebadu, shivering. These are the Upadrava of the Dooshivisha. It is also mentioned in the Dooshivisha context. Then the prognosis or sadhya sadhyatva is mentioned. It is mentioned for sadhya. Dooshivisha is sadhya for which persons, who is Atmavan, जो Atmavan रुग्ण है, or which is of sadhya vyadhi, that is of short duration. Atmavan means those who are having the powerful resistive power, and which the disease, when the disease is of short duration, this Dooshivisha, it is sadhya. But Yapya, it is Yapya for which persons? It is Yapya when it becomes Samvatsarositam. That is when the clinical features, it has been seen from 1 year, it becomes a Yapya Vyadhi. And it becomes Asadhya for Shina and Ahita Sevi patients, who are those who are exhausted or devastated, or who intake Ahita Ashana Bana etc. It becomes Asadhya for these persons. These are the Sadhya Sadhyatva of the Dooshivisha. Next comes the Chikilsa. The Chikilsa is mentioned as Dooshivishartham Suswinnam Urdam cha adascha shodidam Dooshivisharim agadam lehen maduna pludam. That is, those who are afflicted with Dooshivisha, they should be done Swedana, then Urdhva Ada Shodana, then Doshivishari Agada, it should be intaken with the Madhu as a Anupana. In the Doshivisha Chikilsa, the treatment mentioned is Swedana and Urdhva Ada Shodana. The Snehana, it is not mentioned here, or it is contraindicated in Doshivisha, as it may aggravate the condition. As we all already know that because of the influence of the Kapha, Doshivisha gets aggravated in the body. And if we do Snehana, it will aggravate the condition. So the Snehana is not indicated. Instead of that, Swedana and Urdhva Ada Shodana is mentioned together with the intake of Doshivishari Agada. Doshivishari Agada is Pippalyo, Dhyamagam, Mamsi, Rodram, Ela, Suvarchika, Kudannadam, Nadam, Kushtam, Yeshti, Chandana Gairigam, Doshivisharan Namno Ayam, Cha Anyatrabi Vaidyate. That is the condensa Pippali, Dhyamaga, Mamsi, Rodra, Ela, Suvarchika, Kudannadam, Nada, Kushta, Yeshti, Chandana and Gairiga. It is said to be called as the Doshivishari Agada, and it can be used in other Vishas, that is Thavara and Jangama Visha, and other Visha conditions also. This Doshivishari Agada can be used. Next is the Sthanagata Visha Chikilsa. If it is a Sleshma Sthana, the treatment includes Vamana, Ushna, Ruksha Tikshna Praleba and Kashaya Kadu Tikta Bhojana. Then if it is affected in the Pitta Sthana, the patient should be administered Shramsana, along with that Shitala Sega Pradeha, and in the Bhojana they should include Kashaya Tikta Madhura Grida Yukta Bhojana. Next comes the Vatasthana. For the Vatasthana, it includes Madhura Snigdha Amla Lavana Yukta Grita Bhojana, and they should be given Aleba and Pishita Ashana, that is Mamsa Bhojana. It is for the Vatasthana Chikilsa, and for the Vatasthana, Raktasrava and Pittaja Upakrama is mentioned, along with the Panchakarma Chikilsa is also mentioned for the Raktasthana. Thank you. Let's stop today's lecture. If you have any suggestions, please mention in the comment box, and the modern significance we can discuss in the next lecture. Thank you.